Hello everyone, this is Syed Sagheer Ahmed. Welcome you to our YouTube channel. In this video, Anti-Anginal Drugs Part 1, I am explaining definition of angina pectoris, causes and types of angina, followed by treatment of angina. This video is helpful for medical, dental, pharmacy and nursing professionals or students. So, let's get started. So, what is angina pectoris? Let us understand. It is one of the major symptoms of ischemic heart disease. Ischemic heart disease is also called as coronary artery disease or myocardial ischemia. The definition of angina pectoris is the pain in the chest extended to arms due to decreased blood supply to the heart or due to decreased coronary circulation. Angina pectoris is usually seen in coronary artery disease or during constriction of coronary arteries. That is why it is the chief symptom of coronary artery disease. As we know very well, each and every organ of our body need oxygenated blood to perform their functions. Heart helps to supply blood to every organ by its pumping action. Now, heart is also one of the organ. Even heart need oxygenated blood to perform its own function, that is pumping. So heart receives oxygenated blood for its own functioning through coronary arteries. These are the coronary arteries which supplies oxygenated blood to heart muscles. If heart receives more oxygenated blood, then it will work efficiently and pump more blood. If oxygenated blood supply to the heart is reduced, then really it is hard time for the heart to work efficiently and to pump sufficient blood. In case of angina pectoris or coronary artery disease, coronary arteries are obstructed or constricted due to the deposition of plaque. That might be a cholesterol or fat or any other substances. Due to this, blood flow to the heart muscle is reduced and pumping efficiency of the heart is decreased. In myocardial ischemia, there is a partial obstruction of coronary blood flow. Here, blood flow to the heart muscles is reduced. Ischemia causes hypoxia, that is decreased oxygen supply, that weakens cardiac cells without killing them. In myocardial infarction, or we can say it as heart attack, there is a complete obstruction of coronary blood flow. Infarction indicate death of an area of tissue due to obstructed blood flow. So, myocardial ischemia, partial obstruction of coronary blood flow, myocardial infarction, complete obstruction of coronary blood flow. In angina, there is an imbalance between oxygen supply and its demand in the heart. Here, supply of oxygen to the heart is reduced, maybe due to constriction of coronary arteries or atherosclerosis, where there is a deposition of plaque in the coronary arteries, or it happens due to the formation of blood clot in the coronary arteries, that is coronary thrombosis. One side oxygen supply to the heart is reduced, another side oxygen demand by the heart is increased. Heart demand for more oxygen when its workload is more. Increased oxygen demand may be due to increase heart rate, increase contraction of ventricles, that is the lower chambers of the heart, or due to hypertrophy of the ventricles. In hypertrophy, heart muscles are thickened and it make really harder for the heart to pump blood. Finally, angina occurs due to an imbalance between oxygen supply and its demand by the heart. To treat angina, we just need to make a balance between oxygen supply and oxygen demand by the heart. Treatment of angina will be discussed in detail in the upcoming slides. Types of angina. Angina can be classified into classical angina or stable angina, unstable angina, and variant angina. Let us understand one by one. Classical angina is predictable. We can predict its occurrence because here pain is due to exercise or emotion or over physical activity. Stable angina patients may have atherosclerosis where there is a formation of plaque and coronary arteries are constricted. Due to this, oxygen supply to the heart is reduced. In such cases, if patient is involved in exercise, then oxygen demand by the heart is increases. This is most common. During exercise, body need more oxygen. Heart pump more blood. Workload on heart increases. So heart demand for more oxygen. So in this case, in angina patients, oxygen supply to the heart is reduced and oxygen demand by the heart increases. Finally, there is an imbalance between oxygen supply and oxygen demand, and patient feel chest pain. Unstable angina is unpredictable. We cannot predict its occurrence because it is seen during rest time or even patient involved in a quite minimum activity. It happens anytime, we cannot predict it. The main cause of unstable angina is rupture of an atheromatous plaque. Here, the fatty material that builds inside the arteries are ruptured. Another cause is deposition of platelets in the coronary arteries and progressive thrombosis, that is the formation of blood clot. Variant angina even occurs at rest, usually due to constriction of coronary arteries. All these causes imbalance oxygen supply and oxygen demand of the heart. Now we will see the overview of treatment for angina. As I told you in previous slides, angina is due to either decreased oxygen supply to the heart or increased oxygen demand by the heart. So, angina can be treated either by increasing oxygen supply to the heart or by reducing its oxygen demand. Now the question is how we can increase oxygen supply to the heart. It can be done by vasodilation or by preventing vasoconstriction. Vasodilators such as nitrates can be given that relaxes coronary arteries and increases oxygen supply. Or vasoconstrictions can be prevented by giving calcium channel blockers. By preventing clot formation in the coronary arteries, for this antiplatelet drugs can be used. By breaking the clot which is formed in the coronary arteries, it can be done by administering thrombolytic agents such as streptokinase. Now, how to reduce oxygen demand by the heart? First of all, try to understand. When workload on heart is more, then only heart demand for more oxygen. So oxygen demand by the heart is reduced by decreasing workload on the heart. How to reduce cardiac workload? It can be done by reducing preload on the heart. Preload is the load of blood falling on the ventricles during end diastolic phase. Nitrates can be given to reduce preload, or by reducing afterload on the heart. Afterload is the pressure of the ventricles to push the blood into arteries during ventricular contraction. Afterload can be reduced by administering calcium channel blockers or potassium channel openers. The clear concept of preload and afterload is explained in my previous video, that is drugs for congestive heart failure part 1. Oxygen demand can also be reduced by decreasing heart rate. For this, beta adrenergic blockers are preferred.